Hello, everyone. It's September the 16th on Wednesday. We always start with an update from the standpoint of respect for those that we've lost, and we've lost 10 more great West Virginians. Our death toll is now 290. Our 281st death was an 80-year-old female from Wood County. Our 282nd death is a 79-year-old female from Boone County. Our 283rd death, a 96-year-old female from Kanawha County. Our 284th death, a 70-year-old female from Kanawha County. Our 285th death, an 83-year-old male from Kanawha County. Our 286th death, a 94-year-old male from Kanawha County. Our 287th death, a 73-year-old female from Mason County. Our 288th death, an 89-year-old female from Mingo County. Our 289th death, an 88-year-old female from Mason County. And our 290th death, an 84-year-old female from Logan County. You can see the youngest of the people that we lost, since yesterday, there was a 70-year-old female from Kanawha County, with the most oldest, a 96-year-old female from Kanawha County, a 94-year-old female from Kanawha County. Do you not feel all across West Virginia, whether you may be in high school, or you may be just working your way to begin your career working, in your early 20s, or you be, middle-aged and your family just doing great and everything, do we not feel like that by some way, somehow, we're letting these people down? Our most elderly, and all of us have grandfathers and grandmas and, our aunts and uncles and people that, have that wisdom of age. And we know how exposed they are, but yet every day I read to you over and over and over how many we've lost. And while this terrible virus or disease or killer can surely attack the young, the elderly is the number one target, and they can't fight it off. And so I ask you, please, over and over and over, please help these people. Please take the responsibility and step up, because these people deserve it, and we're losing them. Now, in the last 24 hours, we've had 220 new positive cases in West Virginia. Our daily positivity rate is 7.61%. Our cumulative rate continues to grow and is now 2.67. The number of active cases in West Virginia is over 3,200, which is 76 cases that we've picked up, an additional 76 active cases since yesterday. Our recovered cases in the state of West Virginia are just slightly under 10,000. Our hospitalized people have gone from 155 to 156. Our reproduction number, our RT number in the state, which is how fast it's going to spread, is still dropping, and is now at 1.22. We're now not the highest in the country in this category. That's the worst. We're the third worst in the country. So we're getting a little better, but we got a long ways to go. Today on our county map, actually Kanawha County is turning red today, along with Mon County. Our orange counties are Putnam, Fayette, Boone, and Mingo. our gold counties are Ohio, Calhoun, Pocahontas, Cabell, Lincoln, and Logan counties. We'll get into a whole lot more about our numbers and different things that we're doing in just one second. One thing that I'm delighted that we finally solved the riddle on this is in regard to daycare. You know, West Virginia has received a total of $23 million from the CARES Act to provide and support for our state's childcare network. And these funds were depleted, and this program was set to end on September the 30th. We've been working really, really hard in trying to find a way through DHHR that we could continue this on if the federal government drops this off, because we feel like this is really important. There's 3,400 families that would be served each month and who are deemed essential workers in West Virginia and defined by my original executive order. So today, I am really excited to announce that we are committing another $6 million in funding to continue this program through the end of the year, through December of 2020. And even though the federal money ran out, I still believe there's a chance that they'll come back and they'll backfill that. But even if they don't, we've got the money, we figured it out, and so we're going to be able to continue the daycare funding for our essential workers and our families and everything through the end of the year. So that's some good news. Also today, I've got Dr. Marsh, our Chancellor Sarah Tucker, and Dr. Lee Smith, the head health officer in Mon County that are joining us, and we've come up with a way that we can better serve our people and count the people properly from the standpoint of West Virginia University, as well as throughout our state with our colleges and universities, and not make them skew our numbers and knock our numbers completely out of whack. So at this time, I guess I'm going to pass to Dr. Marsh. Is that correct? And then we're going to come back to Chancellor Tucker and Dr. Lee Smith, I believe. So if Dr. Marsh, if you'll take over at this point in time, and maybe you guys can explain what we're going to do.
Thank you, Governor, and hello, everybody. It's always a pleasure to be with the great people of West Virginia, and certainly with the senior leadership of the state and the governor. What we have done over the last 48 to 72 hours is really continue to evolve our thinking and how we can best try to provide for the ongoing public health of our state, reducing the spread of COVID-19, yet also make sure that we are opening up opportunities in a safe way for our children to get back in the classroom and to try to return some greater sense of normalcy. And as we have talked and talked extensively yesterday during the special press briefing, I think that the alteration that we've made in the model that we started with is that we have added the gold color, which allows us to take those counties that are really on that closer to the interface with yellow and start to, in a safe way with additional safety measures in all the schools, to be able to help those children get back to the classroom and enable the classrooms to be as safe as possible for teachers and other folks who work there, but also to make sure that we are not, by our own approaches, our own methods, we're not reducing that drive to test more people, because we know the more people we test, the more people we identify, particularly those asymptomatic, pre-symptomatic people, and the more we can isolate those people that might spread to others away from the rest of our populace so that we start to control the rate of spread of COVID-19. And as we look at these special circumstances in communities and counties that house our higher learning centers, including our universities and colleges, we know that in West Virginia and around the country, that the repatriation of larger groups of young people, some of which are on campus, say at West Virginia University in Morgantown, and we'll talk about the specific incidents, but then also talk about a more generalized approach. But we know that there are increased numbers of COVID cases among young people, and we see that in Morgantown with the majority of people testing in that 10 to 29-year-old range. So as we look at these special populations and try to understand the impact of these populations on the spread to the community members, which is really what we're looking for, then we are starting to continue to think flexibly and differently about how we can start to create the ability to more precisely define what smaller groups of people, say, for instance, in this kind of a setting, what the real risk is to the community. And to that end, we have a group of really very outstanding community health officers and local health departments, but really, truly, one of the best people that we have in the entire state is Dr. Lee Smith, who I learned last night is also a lawyer, which makes me a little nervous as a doctor, but I'll save that for later. But Dr. Smith has really been deeply involved in the state's public health for many, many years, and particularly has really been front and center to the issues with WVU and Mon County and Morgantown, along with the other community county leaders and city leaders. And so we have turned to Dr. Smith to start to ask the question, how can we start to really discern more precisely the risk of the students, and what group of students are appropriate to stay included in all of the community reported numbers, and perhaps are there a group of students that may not serve the same risk to the community that then we could start to look at so that we can more fairly allocate those numbers and risks to counties like Mon County, because Mon County has been red for a while, and without the ability to start to navigate that in a fair way, then we're worried that Mon County may not be able to get back person to person. One more point, and I'll turn over to Dr. Smith. But with the change that we also made with the positive rate, this is an opportunity for Mon County, and the governor talked today about Kanawha County and other counties that are gold, to really start to take that second path toward reopening, getting back to the gold and below, by really starting to test aggressively the population. And today's numbers I saw on the DHHR website, we tested a little over 3,000 people yesterday, and we really want to get that number up to 7,000 to 8,000. So as we look at trying to bring more testing to our gold, counties, to our orange counties, to our red counties, to our counties that have a higher incidence rate and more activity, then we really urge, encourage, beg, plead for the people of the county to show up, get tested, because the more people we test, the more we identify anybody who might be, able to spread and not know it, but also the more that we start to increase those negative tests, which over a 7-day rolling average is another pathway. If you can get that number below 5% over a 7-day rolling average, it's another way that we can reopen the community and feel safe about it, because that is a standard that is supported by the Centers for Disease Control, the World Health Organization, and states like New York State, that then we could have that second pathway, which really does then, drive that number through a lot of testing. So show up for the testing, and we'll bring that testing to these communities. But Dr. Smith, I'd like to turn it over to you now to get your input on what your thoughts are from your public health hat and how we might be able to address the issues specifically in Monongalia County, but also then with Chancellor Tucker, how we might be able to take these observations and create a foundational approach to all communities with universities and colleges that then we could apply the standard to. So Dr. Smith, I'll turn it over to you, and thank you so much for your service and the excellence that you've done your job for many, many years. We really appreciate that.
Well, thank you too, Dr. Marsh, and thanks for the opportunity to present the views that we see here in Monongalia County. And so many of you know that Monongalia County, even though we represent ourselves as a large population, is still a rural county with some centralized populations, specifically in Morgantown. And we've been analyzing the data that we've looked at and collected since July. And at that time, we've seen that there are several data points that I think bear out discussion. And the first is that for our particular county, that 20 to 29 age group still is the vast majority of the numbers that we're seeing. And of course, it varies depending upon the day and the numbers, but it's always between 60 to 80 to 90% of the patient positives that we're seeing. And I think it's of note that it's Morgantown that is seeing the positive cases, meaning that we're not seeing positive COVID cases in the western part of our county, in Blacksville and some of the more rural areas. And I think that by and large, this is because they are rural and they're somewhat normally isolated. But there is a great concern about the spread of COVID from university students or people associated with that to the general population. And we have been very careful and collected data now for many weeks, and we do not see that being borne out. In fact, if you look at those counties that surround Monongalia County, whether it's Wetzel County to our west, or Greene County and Fayette County above the Mason-Dixon line in Pennsylvania, or Preston County to the east, Taylor County, Marion County, or even Harrison County that were linked by the interstate, we're not seeing similar rises in COVID cases in their population. And I can say that it was revealed to me last night that regarding Preston County, there are more people in Preston County working in Monongalia County that are employed in all of Preston County. So I think that the fact that we employ a lot of people from surrounding counties, that we're not seeing the spread in those communities. And so West Virginia University has stepped up and realized their role in this and has provided a secure and monitored location for their students. And our data shows that these cases that are congregated into this environment do not result in community spread. And therefore, we feel that these people should be considered as a single outbreak because they're within a congregate setting and treated similarly to how we do those in nursing homes. And I think to Dr. Marsh's point that this is a model that we think could be duplicated for exportation to other counties where there are other higher education. And so I think that would be all I would like to say on the subject, unless there's any questions.
All right, thank you both. Now we'll go to Chancellor Sarah Tucker from the West Virginia Higher Education Policy Commission.
Thank you, Governor, for having us here today. Dr. Marsh and Dr. Smith have done a great job of outlining what's happening at WVU, but let me tell you about what's happening in the rest of the state with higher education. Less than 1% of our students, that's across 20 colleges, are reporting positive test cases for COVID-19. And that is thanks in a great deal to the leadership of our governor, who had all of our students tested before school started so that we knew what the baseline problem was and we were able to take care of it then. It also allowed us to plan ahead. I would also be remiss if I didn't thank the local health departments. You see it with Dr. Smith, just how much effort they have all put in to helping make our campus community safe, and we really appreciate that. I think it's important for all of you to know that state and national health experts tell us that the safest way to deal with positive test results on campuses is to keep those students on the campus to address their needs, to care for them and isolate them within our community until we know that they can't spread the virus any further. Our colleges have prepared to set up isolation housing for students who test positive. They're following guidelines by the American College Health Association to help ensure the health and safety of our communities and the communities in which they are embedded. For right now, what we are recommending and what DHHR and Monongalia County Health Department and WVU are implementing are several things. The first is that those students who are on-campus students who isolate together in a facility with appropriate security and monitoring in place, those are really important, security and monitoring in place, be counted as a single positive. We're not talking about students who are out living in the community. We're not talking about students who are living in apartments. We're talking about on-campus students who have isolated in a secure and monitored facility. Further, we're recommending that incentives potentially be given to students who live off campus who are willing to isolate on campus in one of those secure and monitored facilities. We're not going to go around and make students go into one of these secure dorms. But if an off-campus student feels comfortable moving into one of these on-campus facilities, we would like to be able to provide that opportunity for them. And finally, we're recommending and paying very close attention to the mental health needs of our students who are in quarantine and in isolation. We're offering counseling services remotely and considering safely isolated opportunities for those students to get outside. Isolation can be very difficult for the mental health of our students, and we want to make sure that we're taking care of them and properly dealing with any issues that they may be having. As Dr. Marsh mentioned, we're also working with DHHR and with the National Guard to come up with an ongoing plan for surveillance testing of samplings of our students and our staff. We know that that's important. Just as our baseline tests were important, we need to continue to monitor the health and the safety of our campus communities. And so we're getting those plans in place right now. Governor, I want to thank you for your support in all of this effort and everything that you're doing to help us keep our students and our community safe.
Well, let me just say this. I think this is another step of progress, another step, to where the great people from, Sarah Tucker that heads up our higher ed people and, the great people at WVU and Dr. Smith and all the great work that he's doing in Mon County and has been doing forever. And it just goes on and on. But this is just another step of improvement and to where that we may have very well had numbers somewhat skewed and it just moves us more and more and more towards the finish line and the finish line will absolutely always be the vaccine. And so, but let me follow up just 1 second on what Dr. Marsh, elaborated on a good little bit, and that is the value of getting tested, the value of significant testing, especially in the counties of, gold and orange and red, because it may very well be that if you'll remember what I said to you yesterday, we now have a dual pathway that you can get your color code down and actually be able to do more things within your counties. One is the infection rate, and basically that is just purely driven by the number of positive cases that we get. Now, in a situation just as that, what we got into was a lot of people became reluctant to go get tests. And then what we had happen is we were only testing the sick. And so we could never really pick up on those that did not have symptoms and absolutely be able to do something about it. Now, so that if all we do is lay down our pencils and stop negotiating and stop moving forward, and all we do is test only the people that are the sickest, then absolutely you will continue to paint bad colors for your county, and absolutely we will not be able to probably spin out of this. Now, on the other hand, what we've done is we've come up with the either or, and the or is the positivity rate. So basically that is just based on the number of tests we take divided into the number of tests that are positive, or the positives divided into the number of tests taken, and therefore we come to a rate. Now, that rate is purely driven by the number of tests that we are actually doing. So the more tests we do, the likelihood, the lower that rate will be. We'll take either one in any county. We'll take either one, and whichever one you're the best at, that will be the color that you'll be. So it's an either or, and whichever is less is what you'll be. So, and you say, well then why? Why are we doing this? And the why is just as simple as just this. At the end of the day, what do we want to achieve? We don't want to just achieve the ability to go to school or the ability to play a game or whatever. We don't want to just achieve that. What we want to achieve is wellness in the county. And we know that there are many people out there that are spreaders, that are spreading this, that don't even know they're sick. So if we can encourage more testing, the likelihood of finding more and being able to stop the spreading and stop me going through and reading, like I read today, 10 additional deaths. To be able to get us to stop that, I got to have tests. I got to have bunches of tests. So you, as Dr. Marsh explained, you and your counties, especially the super red counties, whether it be Kanawha or Mon County. To be perfectly honest, in a lot of ways, especially in Mon County, because they've been red for a good little while now, a lot of people are losing some degree of hope. That's the worst possible thing that can happen to us. So we encourage you in every way to go get tested. The more we test, the more we'll learn. Now, and we'll be providing an incredible amount of testing opportunities right in those counties. And today, I'm glad that we just announced, or maybe it's just gone out, that we're expanding the hours from 1 to 8 o'clock in Kanawha County today, and we're expanding dual lanes to where anybody that's wanting to come and be tested, not only our first responders, but anybody that's wanting to come and be tested, come. We'll test you. It'll just help every last one of us. Now, I'm going to go through the other stuff. I'm going to go through it pretty daggone quickly. But our long-term care facilities, we've got 36 outbreaks in our long-term care facilities. Our churches, we now have 8 active outbreaks. We now have Harrison County and Nicholas County that have joined us as new. Fayette, Mingo, Kanawha, Wayne, and Wyoming counties also have problems there. You know what to do there. You've done it from the church community before. Please keep that up. We got to turn this a little bit back our way, but the church community's really stepped up, and I think they're doing a lot better. Wear your mask, the pew, keep it in between you. From the West Virginia unemployment numbers, we have now dropped to 8.9%, down from 10.5% in June. Scott Atkins will be with us today. Without confrontation, we have different feelings and different beliefs and everything, and what do we try to do? We try to work through those problems to good solutions, and I think we're really close to having that situation resolved and resolved in a really positive way that'll be really beneficial to to Kanawha County and to our state, as well as the Bible Center. From the standpoint of corrections, we've now had our second inmate death confirmed at Mount Olive, a 73-year-old male that died on July, I don't know, well, you know, we've now confirmed, I'm sorry, a second inmate death at Mount Olive, and I shouldn't go into the rest of it. Let me see if there's anything else here on this. We now have 24 active inmate cases at Mount Olive. They are down to 14 active inmate cases, you know, 14 active employee cases with 10 of those at Mount Olive, and from our National Guard standpoint, they're continuing to sanitize Mount Olive, and they're working on that this morning. Our small business grants are continuing to go out the door. We've got 5,100 applications now. That's up significantly, and that's good. We just keep trying to send the money out, so please apply and apply quick, because September the 30th is the cutoff on that. We're 111,222,000 and change that have gone out to 191 cities and counties. That's good. We continue to try to get you qualified and continue to, you know, say, just continue to apply. We'll continue to send that money out. I want to recognize AEP today. They did something that's really, really neat. But we have a huge warehouse and maintenance facility near Nitro that the Guard operates, and it's where we store our PPE, and it's also a food bank that supports thousands of West Virginia. Yesterday, the power went out, and AEP worked throughout the night to replace underground lines to get the power up and going this morning. And we want to send out a special thanks to them and everything for stepping up and doing that great work, you know, so that we, you know, could ensure the safety of the warehouse. And so thank you again. Last thing I've got to report is on our census. Now get this, West Virginia, you're at 99.4% that you have counted. You're now tied with Idaho as being, you know, the best in the entire country. It's, you know, and it's just, it's not that, well, it is a great big thing, because it will really influence our state for the next 10 years. But the thing that is amazing is always when you call on West Virginians, we absolutely respond, and you've done great work here, and it's really good. So I couldn't be more proud of you. I thank all the people that worked on our universities and our colleges, and West Virginia University especially. And you know, from the standpoint of how we're going to count people, I'm very hopeful to tell you over and over that you know, that we have two pathways now that absolutely, you know, that everyone needs to understand. We want the infection rate to go down, but to be able to drive the infection rate down, we've got to know who's sick. And to know who's sick, we got to have the test. So we're giving you that dual pathway, and you know, and if you get tested a bundle and everything, that positivity rate's going to drive down, and then we'll be able, as a health community, to spin right back around and absolutely drive down the other rate, you know, the infection rate as well. And then we have the best of two worlds. And so I thank everyone, and I think we're going to pass now to Superintendent Birch, and we're going to keep going here.
So thank you, Governor, and I know we had a special press conference yesterday to focus on school and the new Kellers and things like that, so I'll be brief, but I think first and foremost, on behalf of public education, I want to thank Dr. Tucker, Chancellor Tucker, and President Gee, Dr. Smith, Dr. Marsh, and not because of just figuring out how to tackle this for how we're going to count them or a map, but the point for me as the state superintendent is focusing on how to take care of these students in higher education so that they are quarantined, they're taken care of. I love that we're also taking care of their mental health, Dr. Tucker. And the ability that when we do that, we're making strides to make our community safer. And I know that the superintendent there in Monongalia County is one of 55 that I met with yesterday. They all want their children back in school. It is absolutely no substitute for having a teacher. Our teachers are the key to how successful these children are going to be. They just absolutely are. And we're doing everything we can to get as many children back in school as we can. Yesterday we used the number of 67,000. That's the number of children impacted by the metrics this week on that map. And I have to reiterate over and over that as parents and folks call our hotline, this is a health map. This is a map about community spread, and we're trying to make decisions as best we can for education based on that map. I want, as much as the governor, as much as our superintendents and principals and teachers, as bus drivers and cafeteria workers, we all want those children with us, but we have to make decisions. So when parents call and ask, how do I plan? This is really, it is hard. And I tell many that reach me directly all the time, I wish I could predict a pandemic. I really wish we could predict it, and a map's what we have. My friends across the nation, except for apparently Kentucky now, do not have a tool like this to use. They don't have a tool to help make decisions. So I trust our health experts, and I want to end with what I was reminded by superintendents on a call yesterday. And they said, I didn't know how they were going to take the new Goldkeller. I wasn't sure if they thought, well, are we changing the map again, Governor? Are we making tweaks? And the superintendents reminded me of something. They said, I hope that you are. I actually hope each and every day you're willing to make tweaks to take care of our children, to get many children back in school. And one superintendent, I just want to share this, said, you do realize that the map today is safer for all of us than it was 4 weeks ago. And think about that. When we originally launched this map, we were going to allow counties to remain open, green and yellow, if they went up into orange. In fact, we were going to allow them to stay open all the way up to 25 cases, infection rate. And with the changes we've made, the governor and our health officials have said, no, we're actually going to close those schools down. It's just not safe. We're going to make a tweak, and we're going to find a safety net we feel is okay to open up those schools. And that's that new Goldkeller. And what I want to share with the parents and public out there is that after listening to the superintendents yesterday, I was just have a renewed just energy of those caring adults out there that really want to take care of these children. And so on behalf of the superintendents and our public education, our boards of education, Governor Dr. Marsh, Dr. Crouch, everybody involved in making this tweak happen, General Hoyer, Chancellor Tucker, and Dr. Amjad, thank you.
All right, thank you, Superintendent. Next, we'll go to Scott Adkins, the Acting Director of Workforce West Virginia.
Good afternoon. Thanks, Jordan. As Governor Justice mentioned, he talked about the unemployment rate there just a little bit for August. We dropped down to 8.9%. To put that in perspective, in February, before the pandemic hit, we were at 4.9%. And the labor force participation rate in West Virginia was at a 30-year high in February of this year. The unemployment rate jumped to 15.2% in April, and now we're trending the right way at 8.9% as we move into the fall months. Workforce has dispersed more than $1.5 billion in unemployment benefits since mid-March. This week, we're going to disperse $100 million more in unemployment benefits through the FEMA Lost Wages Assistance Program. West Virginia, as I mentioned last week, has been approved for 6 weeks of payments. And so for folks who are eligible, you stand to gain an extra $400 in benefits. The PUA claimants were paid overnight. Most of those folks, those funds hit their accounts today. The non-PUA folks, if you're on extended benefits or PEUC or on regular state unemployment, we decided to issue paper checks, which allowed us to mitigate some of the programming time that was going to be required to be able to make direct deposit or paid to a debit card by 4 or 5 weeks. 20,000 of those checks went out yesterday. There's 30,000 scheduled to go out today. And so every unemployment claimant in West Virginia should receive their LWA payments by the end of this week or by early next week. I think that's it, Jordan. Thank you.
All right, thank you, Director. Major General Hoyer with the West Virginia National Guard, and Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer, are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Amanda Barron with WSAZ.
Thanks, Jordan. Hi, everyone. Amanda Barron from WSAZ. I wanted to ask what you guys think the increase in cases in Kanawha County is being attributed to. We don't even have kids back in school yet, and we're seeing the increase. So I just wondered if it was nursing homes or other settings that you might be able to point us to. Thank you.
Okay, Amanda, I think Dr. Amjad and probably Dr. Amjad more than anyone could answer this question, but I think what you're going to find is community spread, community spread, community spread. But, but anyway, Dr. Amjad, if you'd jump in, please.
Sure. Hi, Amanda. Yes, the governor's right. We have a lot of community spread in Kanawha County. We have over 20 outbreaks, probably 12, 15 long-term care facilities. We have at least 2 churches, if not more. I'm looking at my sheet here, but a lot of community spread. The nursing home outbreaks there, you're looking at staff outbreaks there, but a lot of community spread. Dr. Sherry Young is doing a great job of community testing out there, but we can always do more testing, but a lot of community spread in Kanawha County. But I want to encourage everyone to use masks in Kanawha County and to continue to do testing in Kanawha County. But a lot of community spread is in Kanawha County right now. Thank you.
All right, thanks, Amanda. Next is Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers. This could be for higher education and health, but I mean, I think if I heard you correctly, 1% of students in the state's colleges and universities are sick with, or rather been infected with COVID-19. Obviously, the change in this that you all are talking about are very much, I would imagine, pointed at WVU, given the number of students that they have in isolation in Arnold apartments, given the number of students that they have in quarantine currently. Can someone talk a little bit about the security measures that you all were talking about there? Because I know in other states there have been issues where they have done something similar and isolated students in one place, but those same students were still able to come and go fairly freely. So that wasn't or isn't very successful in those other states. What are we doing here to ensure, not just at WVU, but obviously if we try this at other colleges and universities in the state, what are we talking about in regards to making sure if they get infected that they stay in isolation in wherever the designated place is? Thank you.
Stephen, I think Chancellor Tuckler's gonna answer this, please.
Sure. So, I mean, Stephen, you're correct in that the dormitory isn't a jail, so we can't throw people in jail and prevent them from leaving. But what we have are access to nurse navigators on site during the day, access to nurses 24/7 by telemedicine for all the other students. We have security guards that are present at Arnold Apartments, and students have to swipe cards if they're going to enter the building. And so we know if a student has left, and if they have left, then that becomes a matter of student services penalties. So as you've seen, WVU and some of our other institutions have taken pretty dramatic measures at suspending and even expelling students for not participating in what's considered part of the behavioral code of conduct for our students. And that certainly would be an option for students if they were to break that, but so far that has not happened.
All right, thank you, Steve. Next to Brad McElhenney with West Virginia Metro News.
Hello, Governor. Hello, everyone. You know, I'm still trying to figure out the color-coded map a bit. Yesterday, after the new gold was announced, some counties that had been on orange, get your whiteboard here, but if you had been on orange but then qualified for gold, were essentially grandfathered in to the dominant Saturday map as gold. And so that seems to mean that they can now have school later this week. or maybe even right now, potentially can resume or begin an athletic schedule. But in some of those cases, in at least 4, I think, the daily map shows them in orange, which would be a higher standard and more recent numbers showing them that way. Is there any hesitance at this point about their classroom status or whether they should be having games if the more recent numbers show them on orange? Thank you.
I think I can answer this, Brad, but what we've got to do is this is going to go both ways. I mean, we're going to have situations to where on Saturday night, like Monroe County, here's a perfect example. On Saturday night, Monroe County was in the orange, and we have to have a cutoff. We got to have a cutoff. So what we did when we added the gold, we said, if you basically dropped into the gold, we would retroactive back to Saturday night, and then you at that point in time were eligible to go back to school or even resume sports. Okay, we got that. Monroe County was in the orange on Saturday night. Monroe County couldn't qualify to go back and drop into the orange or drop into the gold or the yellow. So Monroe County is stuck for this week in orange, and absolutely, but next week, right now, Monroe County's numbers have trended all the way down into the yellow. And so Monroe County will be good to go next week, but they can't go this week. You have to have a cutoff. And you're going to go both ways on it and everything. And just because, like a county that was effectively by the numbers on Saturday night in the gold, we have to have that cutoff, and we've got to say, okay, they're gold for the entire next week. And if they trend in the next week up in the orange on a daily basis, well, we've got to go with the cutoff date, and that's why you're going with that Saturday night.
All right, thank you, Brad. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi, everyone. It's Taylor at the Herald-Dispatch. I wanted to ask DHHR about a release that was sent out last week that said that there was an emergency rule requiring EMS workers to wear face masks at all calls that they go to. So I was wondering why that wasn't already the rule, what kind of prompted this, and what prompted the change now.
Okay, Secretary Crouch, maybe can you or General Hoyer answer this? I don't know why, but I just can't. If it's Taylor, I can't hear real well. I'm sorry.
Governor, this is Bill. I'm happy to answer that. Taylor, it's a good question. The reason for the change and the addition of the rule, and we assume that all of our first responders will use masks everywhere and anywhere they are out in the public. But we've actually had reports from our local health officers that we have first responders who are not using masks, not wearing masks. We've had a couple of police departments in Kanawha County that have had outbreaks and reports of not using their masks. So EMS folks are much better at that we found, but especially on a call. But we want every first responder to wear their mask. So the rule was something that we wanted to do to promote the mask, the wearing of the mask, and to make sure that they understood that was an important effort. Those folks do a great job. We're always thankful for them and what they do to keep us all safe, and everything they do is important. And we want to make sure we provide them the appropriate PPE and masks, et cetera. And those masks need to be worn out in the public. So that was the reason for the rule itself. Thank you.
To me, just 1 second. And Taylor, let me just say just this, that from the standpoint of our first responders, whomever they may be, them not wearing a mask is really, really, really not good, because the likelihood of them coming down with this is probably just higher and higher and higher. Their courage is absolutely appreciated beyond belief, but we need them to wear their mask and everything in every way, because here's the bottom line to the whole thing, and this is what I want all of our first responders to hear. You're appreciated off the chart, and I love you with all my soul and absolutely respect all you're doing in every way. But when we lose you, we lose a major, major cog in the wheel. So please protect yourself in every way, because when we lose you is when we become really, really lost. We need you really bad. Wear your mask. Please protect yourself in every way. We've got to have you. You are our front line in every way. And so please protect yourself.
All right, thank you, Taylor. Next to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. A lot of revisions to the map, and I understand the reasoning that you're explaining and why you're doing it, but it really looks like in a lot of ways we're lowering the bar to try to get to some goal that we're looking for, whether it's to get children back in school or to lessen the impact of WVU or whatever the goal is. So instead of tweaking the map so much, and I know this is probably an impossible question, Dr. Marsh, you're welcome to take a shot at it. How about we just do better with our results and not have such high numbers? How about we control the student population at WVU or send them home? Or how about we, if a school opens when you tell them not to, you shut them down? I'm just kind of, yes, the carrot is great, and asking and begging and pleading is great. Sometimes as a parent or an authoritarian or a governor or a government, you kind of have to say, you can't speed. And if you do, you're going to get the ticket. So why are we not moving more in that direction? Thank you.
Okay, Dr. Marsh, before you go, let me say this, because, I love Kenny to death, and Kenny's a smart guy, and he asks a lot of really, really good questions all the time. And his question is really straightforward and really simple, and I've said it over and over. You got a tough decision to make. And that decision is just as simple as this. If we want to be that black and white, we can say, okay, I know exactly how we can make this thing better. And I'm sick and tired of calling these people's names out and saying that there's 10 people that have died in West Virginia. The thing we need to do is go all and batten down the hatches and all of us stay at home. Now, if we do that, we'll make the numbers better to some degree. That's the balance act, and that is the dance. And that is what is the difficult thing to do. To be able to keep us running economically, to be able to keep us having the opportunity to go to school, to be able to keep our businesses and the functions that we do every day to be somewhat normal, it is one tough balancing act. That's all there is to it, And I get it that you don't have to shut everything down. You can just cut out the bad eggs. The ones that are the worst, cut them out, and we're trying to do that. We absolutely try to do that nonstop. But Kenny, I love you to death and everything, and I think that your questions are great. But this one, the answer. Just like you already said, there is no answer. You just have to do the very best you can possibly do to live with this until we get to that vaccine. But Dr. Marsh, go ahead.
Well, Governor, you answered in most ways that I was going to add. Kenny, we talked from the very, very beginning of this pandemic about the power of staying together. And I think that as we go through this really generational event, this black swan event, this event that has really caused so much stress on all of our systems that it's quite unprecedented. What we know, and this was right from the beginning when we looked at the mathematical simulations, that the most powerful way for us to succeed as a state, as a community, as a set of communities, is stay together, pull the rope in the same direction. And really what we're trying to do by the tweaks of the map, and you've heard this from, from all the people on this call many, many times, we're really trying to focus at improving the public health, the rate of spread of COVID in the state of West Virginia. But how you get to it is not clear all the time. There's no, playbook to do this. And so what we recognized was that one of the flaws in the initial map that we made, and Superintendent Birch suggested this, is that we had counties that could go into the deep orange to the red and stay in school, which the governor then, understood with the rate of spread that we're seeing in the state was not a safe thing to do. And we stopped that. And then we created this second tweak to provide counties that were deep in orange or red with additional opportunities that also combine the opportunity to test more, which is what we really want to see. And we've said that the secret sauce in controlling the rate of COVID spread is really, really extensive testing, not only of our symptomatic population, but of our at-risk population, going into those hotspots, those counties with more activity, those areas run to the fire, as the governor said. So all that we're doing is trying to keep people together, to make sure that we are able to effectively sample the areas where we know we have the most spread, just like we would in any other epidemic, pandemic. That's what's done in Africa with Ebola and other types of infections, is you identify people before the thing rages out of control. You put some firewalls up and stop the embers from becoming the forest fire. And I think that's what we're doing. And we're doing it by understanding better our state, our rural population. We're different than other places, and we're proud of that. But we're trying to create a set of principles and an approach that is really unique, that can be a model for other people to follow, but to get us to that promised land, which is not only to open up the schools for our children and all the other things that we want to do, but also use the same approach to reduce the community spread in West Virginia. And I am optimistic that these tweaks and these additional approaches, this flexibility, agility, is going to serve us well. And we'll continue to try to navigate this. As much as we see something that works, we'll continue it. If it doesn't work, we'll try to fix it. So thank you for your question.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. When does counting the WVU cases as being in a congregate setting, when does that take effect? Is that going to go into effect immediately? And what impact do we expect that to have on Mon County's color-coded status?
Sarah, you want to take this, or Dr. Marsh? Dr. Marsh, maybe you're better to take this, please.
Oh, sure. Happy to do so. So we're working closely, and I would invite Secretary Crouch to also comment. We're working to create the ability to do this in a very specific way, because one of the issues is if we count these folks as congregate settings, we need to make sure that the numerator and the denominator are affected by our removal. And we anticipate that, looking at the data, that it's likely that it will have an impact on Mon to the orange color. We don't know that completely because we haven't done all the data, but that's what we anticipate. Secretary Crouch, I don't know if you have additional comments.
No, Clay, that's pretty accurate. We want to make sure we're careful in how we do this, and that we're accurate, and that we make sure the data is accurate. So we should have that done by tomorrow. That's our plan. So that's the goal, and I believe we can do that. But we've got to make sure we do it right. As the governor says, we want the data accurate. We want to make sure we're good at what we do with this.
Back to me just a second. And I'd like to add just one thing. when I suggested this and everything, and the days are all running together now, but a couple of days ago that we needed to take a look at this. I mean, let's just use common sense again. You know, we have a population, you know, with students that come into a county, and all of a sudden that county is flooded maybe with positives, and that county is skewed or biased in a way that it hurts the county's ability to go to school or play sports or whatever they may do. You know, it hurts them and everything. And so we've been trying to figure out what was fair, because we know those students, the benefit of WVU to Mon County is phenomenal, beyond belief. And it's like, and we know those students travel and everything. But we also know that some students, you know, when they were, you know, tested positive, went home. And other students are in, you know, the Greek houses, or other students are in the apartments and everything. Or other students, you know, went to Arnold. And in all of this, the wisdom of all of our leaders again and our experts decided that the Greek houses and the apartments, for right now, we have to count them, you know, if there's 23, we count 23. But for those that are in a congregate setting like Arnold, maybe we shouldn't be counting them that way. It's exactly the same thing from the standpoint of Kenny Bass's question the other day, where Kenny said, you know, an individual that's tested positive has tested now 8 times. And are we counting that as an 8 times or 8 different people? And so we've got to make sure that we, you know, that we cleanse that and make sure that we're not doing that. But from the standpoint of those in apartments, they count for every one of them. For those from the standpoint in the Greek house, they count for every one of them. And for those that are at Arnold, they are congregate. And so we need to count them properly for the fairness and goodness to Mon County. So that's what we're trying to do, and we got to get it done. And Charles, your question is when? And I think in all fairness to Mon County, we have got to get this done by tomorrow at midnight, because that's going to be the cutoff for the next week. And wouldn't it be just wonderful if, in fact, we got a number that came out in the gold? I don't think that's going to be the case, but I do think we're at least going to show Mon County that now you're trending in a great way. And if we can amp up the test, you may be able to get yourself there in the positivity side while your infection rate's going down. And the other thing is just this: if we'll be just fair, the more we test, the more we cut those people out that are absolutely infectors or spreaders, and the more health-wise and goodness we bring to our county, and we shut this nasty thing down. We've got to test more. Everybody in the world is saying we've got to test more. You know, we've got a color code system, and basically we didn't shut down our testing, but we went down to where we were only testing the sick, and we needed to change and we needed to adapt, and that's what we've done. So that's it. We need to have this adjustment done by tomorrow midnight. I do not think it will do anything other than bring Mon County down in the orange, but if that be the case, that restores some level of hope and everything, and we want to get Mon County down, and we want to be able to get them back to school, get them back to their lives in a normal way, and more than anything, in any way, we want the people of Mon County to feel safe, and we've got to quit reporting, you know, losing people in this state. And so we're trying every way in the world just to stop this terrible killer.
All right, thank you, Charles. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet members. I just need one clarification and a question. I just want to be clear, the map we're all going by, the Bible, was the map that was updated yesterday, the updated Saturday map, not this morning's map, but yesterday's map. And then for Clay Marsh, I know you say we're testing 3,500 people a day. You want to test 7,000 to 8,000. Can we do that? Do we have the capacity, the money, and the personnel to do that? And if not, how do we get that done?
I can answer both really quick. We're going with the map as of yesterday. That's the Saturday night revised map as of Saturday night for this week. We will revise again, and it will come out at 5 o'clock on Saturday for next week. That's as far as that goes. As far as the testing, our National Guard General Hoyer, I think, is on, and Dr. Marsh could answer it, I could answer it, but without any question, we can do it, and absolutely we have the resources to do it. General, if you want to add something to that, add it, please.
Yes, sir. Governor, as laid out, the objective is to try to get to 7,000. DHHR has worked aggressively on a number of additional contracts to give us additional capacity. We've been working the Guard with DHHR on working with local health departments to roll out additional testing venues, as well as working for some other options related to pharmacies and federally qualified health centers. So we believe that with the governor giving us the resources we need, we will be able to generate to that capacity as outlined.
All right, thank you, Mark. Next, we'll go to David Beard with the Dominion Post.
Hi there. I'm still receiving comments from people about the ongoing Mon County bar closures, and suggesting that that maybe they need some help to stay afloat during this period. And then it was yesterday, the 15th, that one of our Mon delegates sent the governor a letter recommending that he devote $25 million of, I suppose, the CARES money. Yes, the CARES money. To Mon County to help bars and other businesses affected by being in the red stay afloat. Have you considered that at all, or what kind of help is available for them?
You know, David, we'll look at it and everything, and we're trying to help in every direction we can possibly help, and we'll continue to do just that. I understand wholeheartedly with the bar closure or certain pains that are going on in Mon County are exceptional, and we need to look. So we're going to continue to look and try to do anything and everything we can within our power.
All right, thank you, David. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. I have a demographic question. The breakdown has always been between 0 and 9 years old, 10 and 19, 20 and 29. I heard Dr. Marsh referring to the college numbers being split between the 10 to 19 and the 20 to 29. Would it be that difficult to change the demographics that we do release to include a category of 18 to 24? And maybe that's a Bill Crouch question. Thank you.
Well, it's not my question, so Dr. Marsh or Bill Crouch, one of y'all answer it.
Bill, I'll defer to you.
Certainly, it could be done. Those policy issues are always something we discuss, and how to do this. And as the governor says all the time, this is the balance, and trying to make sure that we open things up versus provide information that people can use to stay safe is what we do, and our goal here. So that's certainly a possibility. We are always looking at what works and what doesn't work. And as Clayton said, that the changes need to be ongoing. The way we're doing this is looking at the outcomes, and having 67,000 children not in school was one of the outcomes that made us go back and look at this, and made us look at what do we need to do to make this work. So it's a difficult balance. There are no right answers. I've spoken to health officers who were opposed to the changes, and I've spoken to health officers who were in favor of the changes, and the same with parents, and the same with the public. So there's no right answer, but certainly going forward, anything's a possibility as we go forward to try to make the best decisions possible.
All right, thank you, Paul. Next, we'll go to Christina Cass with WVVA.
Hi, yes, this is Christina Cass with WVVA. I'm happy to hear about the newest funds being allocated to the childcare services. Would you be able to go into detail on where these funds are coming from and when they'll be implemented, as well as if there's anything else that childcare services and parents need to know regarding these newest funds?
Well, Christine, these monies are coming out of our CARES dollars. we continue to kind of shift and juggle those dollars as best we possibly can and get them, to where they are dollars that are going to qualify to be able to go out this way. You remember what we've done is, and I love the economic parts of what I do because that's the way I've been trained all my life, as a business guy. But when you took that $1.25 billion, now there's another side that was all the grants and all that money, which was even more money than that, but when you take that 1.25 million, or billion rather, and you segregated it into buckets that were insurance buckets that were really going to protect us and everything. From the standpoint of unemployment, you've got all kinds of thousands and thousands of people that are left without a job and left without and wondering where they're going to go. So you had to absolutely take care of all those people, but in addition to trying to take care of all those people, you had to have enough dollars that were set aside to be able to protect our businesses from their taxes just shooting straight through the roof right as soon as we finally walked away from this situation. So that's what we did. And then from the standpoint of our small businesses, how we put money over there, cities and counties, how we put money over there, and we've got all these buckets and everything, but yet we don't have any pet projects. We don't have any water park that Jim Justice wanted or something like that. We don't have that. We have just the stuff that is exactly what we should have done for this state. Now, with that being said, what we've done is we've found as we've gone further along that the economics of our state engine is continuing to run, and we may not need we've got the 278 on the unemployment side and then a 400 on the unemployment side. Well, we know we're going to need the 278, but the 400 now, we believe from Scott Atkins' great work and everything that really we're only going to maybe need 250 of that. So we glean off 50 million of it and we do different projects we glean off 50 million in the beginning to assure us that we're going to be able to cover any additional PPE and or testing that we may need for our K through 12 schools or our universities. Now, when we did that, we didn't really know for sure at all. We didn't even think, that we would have a situation today to where we would be urging you to go, get tested. So we got dollars that are sitting there in a bucket. Now, from the standpoint of where your question is in regard to daycare or whatever, we've still got additional dollars there to play with. And we've still got some additional dollars over here in the small business thing to play with. And so we're trying to just watch those and squeeze those and try to massage those to where we're able to meet these needs as they come up. And that's where the money on the daycare came from. The $6 million came from right there.
All right, thank you, Christina. Our last question today comes from Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Good to be back with y'all. I was doing a little research on the Harvard Global Risk Map. It seemed to be designed by a consortium of some of the leading scientists and epidemiologists from across the country, some of our finest institutions and healthcare facilities. And if they've concluded that at 10 cases per 100,000, you need to move into an orange risk area, who are we to kind of second guess and say, 15 per 100,000 would probably work better for us?
Well, I can selfishly answer that to say, who are we in West Virginia to have been the first in the nation to test all of our nursing homes? Who are we in West Virginia to have stopped, visitation in our nursing homes? Who are we in West Virginia to have tested all of our assisted living, to where no one had done it in the nation? And who are we in West Virginia to come up with a color code system that Dr. Birch comes in here and says is absolutely unbelievable how good it is. And I'll tell you really, really just straight up. In West Virginia, we are not one size fits all. You know, from the standpoint of the Harvard model, how in the world, I mean, even if it were adaptive to Iowa, well, the state of Iowa, all across the state of Iowa, you've got cornfield after cornfield, and you've got industry here and there, and you've got cities here and there, but you don't have Kanawha County and Doddridge County. You don't have that. You do not have Kanawha County and Braxton County. You know, you have a diversity in West Virginia that is so significant that a Harvard model just can't fit every single need there is in West Virginia. And we can sit back on our hands and do nothing and continue to move forward in that way. But West Virginians have never, ever done that. Just like they've done in the census. When I called upon West Virginians for help, look what they've done with the census. We could have just sat back on our hands and done nothing there and come in and counted 60% of our population and got X minus whatever funds that we were eligible for from the federal government for 10 years. But we stepped up. We stepped up. That's what we continue to do. So in my opinion, it's better, and we're going to move forward with something that we think is better. And absolutely, from the CDC, all of a sudden, you know, after West Virginia stepped up and said, test everybody in the nursing homes and test them all right now. Well, 17 days or whatever later, the CDC came out and said, we recommend you test everybody in all nursing homes. West Virginia is better in my book. That's all there is to it in so many different ways. We want to learn from our great institutions and our great scientists, no question about that, but West Virginians are damn good. And that's all I can say about it. And so we're just going to continue to be just that.
All right, Governor, back to you.
Well, the only thing I'd end with is just this. You know, my job takes on a lot of different looks. I talked about my job being there to be able to protect you and to make things safe. But my job also takes on these looks. My job takes on grow the economy, grow West Virginia, grow our jobs, and grow our opportunities. It does. And that doesn't stop. And so with all that, what I am trying to do with all in me is first and foremost, get us across the finish line as safely as we possibly can and protect us in every way. But I don't want to lose focus with the sight that I'm here to do things such as make the economics work, make your opportunities work, make there be more and more job opportunities across this state everywhere. That's what I'm going to continue to do. That's what I've already done, and I'm very, very proud of it. But we got to stop this terrible killer. And we're on top of it, and everybody here is all hands on deck, and we're going to stay that way till we get there. Everybody's tired. You know, there's lots of moments that everybody feels alone. And there's lots and lots of sleepless nights. But nobody's going to stop running until we get it done. Nevertheless, I thank you a bunch, West Virginia. You just keep on being damn good. I'm really proud of you.